The PleurX catheter system and the PeritX catheter system let you drain fluid at home and on your own schedule, so you can manage fluid buildup before it becomes too uncomfortable. This video will reinforce the training you received from your doctor or nurse. If the catheter was placed in your chest, you received the PleurX catheter system. If the catheter was placed in your abdomen, you received the PeritX catheter system. The drainage procedure is the same whether the catheter is in your chest or abdomen. Before you begin, read the full instructions for use that come with the drainage kits and follow these instructions every time you drain fluid. You are watching this video because you received the PleurX catheter or the PeritX catheter. This is the catheter. Part of the catheter stays inside your body, either in your chest or in your abdomen. There are holes in this portion of the catheter that allow fluid to enter. The white cuff in the middle is part of the internal portion of the catheter and should not be visible outside your body. The end of the catheter stays outside your body so you can drain fluid. A valve on the end of the catheter helps keep fluid from leaking. It also prevents air from entering the catheter. You'll drain your fluid into PleurX drainage bottles specifically designed for use with the PleurX catheter or the PeritX catheter. These bottles come in two sizes, 500 milliliters and 1,000 milliliters. Preparation and use of each bottle is the same regardless of size. Always use the PleurX bottle and drainage supplies for draining fluid with the PleurX catheter and the PeritX catheter. The active vacuum technology in the PleurX bottles provides suction for drainage and allows you to place the bottle wherever it is most convenient during each drainage procedure. The drainage bottle features a drainage line, which you will connect to your catheter when you drain. The color of the fluid drained may vary. The PleurX bottles come in a drainage kit. The kit contains the sterile items you need to drain at home, including gloves, a new valve cap for the catheter, alcohol pads, gauze, a foam pad, and a sterile dressing. The kit also contains a blue emergency slide clamp. This clamp should be used only in an emergency to close the catheter if it is somehow cut or damaged. See the instructions for use for more information and notify your nurse or doctor immediately if you decide it is necessary to use the emergency clamp. You should drain as directed by your doctor, usually every 1 to 2 days. Do not change frequency or drain more fluid than your doctor has recommended without first consulting your doctor. The drainage procedure should be done using a clean technique. Before beginning each drainage procedure, remove any rings and wash your hands thoroughly with soap and water for a full minute, even though you'll wear gloves during the drainage procedure. Dry your hands using clean paper towels. Remove the dressing from the area around the catheter and discard it. Be sure not to tug on the catheter. Support the skin while removing the self-adhesive dressing. Gently grasp one edge and slowly peel the self-adhesive dressing from the skin. If you notice any redness or swelling around the catheter, any fluid leaking, or if the white cuff is visible on the outside of your body, continue the drainage procedure and then call your doctor or nurse to report what you see. After you've removed the dressing, wash your hands thoroughly with soap and water again for a full minute. Make sure you have a clean, clear area on a table or counter to serve as your workspace. You will want to arrange all of the supplies prior to beginning each drainage procedure. First, open the drainage kit bag and remove the procedure pack. Next, open the procedure pack and remove the blue wrapped bundle and adhesive dressing. Set the adhesive dressing aside and place the blue bundle on your workspace with the folded side up. Carefully unfold the blue wrapping by pulling on the outer edges of the bundle. The items inside are sterile, so avoid touching them. The inside of the blue wrapping provides a clean work area. Remove the drainage bottle and connected drainage line from the bag and set the bottle on the table next to the blue wrapping. Remove the tape from the drainage line and set the covered access tip on the blue wrap near the other items. Make sure you keep the access tip on the drainage line sterile by not touching it, and keeping it away from other objects. The access tip should touch only the blue wrapping. If the cover has fallen off the access tip, do not touch the tip with your hands or anything non-sterile. Pick up the gloves by the folded cuffs at the wrist and pull them on. Both gloves fit either hand. Keep your gloves away from non-sterile items such as skin or clothing. Next, open all 3 alcohol pads and place them on the blue wrapping, but do not remove the pads from their pouches. The alcohol pads are flammable. Do not expose the pads to an open flame. You are now ready to prepare the drainage line and catheter for draining fluid. Close the roller clamp completely by rolling the wheel on the roller clamp toward the bottle. This roller clamp prevents drainage from starting until you're ready. The roller clamp on the drainage line must be completely closed when not draining, or the vacuum in the bottle may be lost. Pick up the drainage line near the tip, twist the cover, and pull the cover off. Set the exposed tip back on the sterile blue wrapping. Holding the catheter near the end, remove and discard the cap from the end of the catheter. Use an alcohol pad to clean around the opening, but don't try to clean the inside. Don't put anything except the drainage line tip inside the end of the catheter. This could damage the valve and allow air to enter or fluid to leak. Do not use scissors or other sharp objects near the catheter. And always remember to keep the valve on the end of the catheter clean and away from other objects to avoid contamination. While holding the catheter, pick up the drainage line near the access tip and gently insert the tip into the end of the catheter. You may feel and hear a small click when they securely connect. Make sure that the valve and the access tip are securely connected when draining. If they are accidentally separated, they may become contaminated. If this occurs, clean the valve with an alcohol pad and use a new drainage bottle to avoid potential contamination. Do not tug or pull on the drainage line. PleurX drainage bottles use active vacuum technology that provides suction to automatically drain the fluid. The support clip on the drainage bottle maintains the foil vacuum seal until you are ready to break it. To open the seal, steady the bottle with one hand and remove the support clip with the other hand. Hold and push the white T-plunger straight down to puncture the foil seal. Remember that the white roller clamp on the drainage line is still closed. To begin draining, slowly open the roller clamp by rolling the wheel away from the bottle. Fluid will start to flow into the vacuum bottle. You can adjust the flow by moving the wheel on the roller clamp as desired to open or close the clamp. Drainage usually only takes 5 to 15 minutes. It is normal to feel some discomfort or pain when draining fluid. If you do experience discomfort or pain when draining, roll the wheel on the roller clamp toward the bottle to slow or stop the flow of fluid for a few minutes. If you don't feel better after doing this, or the pain is severe, or you have worsening shortness of breath, contact your doctor or nurse. Although rare, pain may be an indication of infection. The flow into the bottle may slow down when the fluid is almost completely drained. It is normal to feel some discomfort as the rate of flow decreases or stops. This is a sign that you have completed your drainage. When you're finished draining, or if the bottle is full, close the clamp on the drainage line completely by rolling the wheel toward the bottle. If you need to use a second bottle, disconnect the drainage line and follow the instructions for connecting a new bottle. You do not need to clean the catheter tip between bottles. Do not drain more than 1,000 milliliters from your chest at any one time. Do not drain more than 2,000 milliliters from your abdomen at any one time. When drainage is complete, disconnect the drainage bottle from the catheter by holding the drainage line near the access tip and the catheter near the end. Then, pull the access tip out of the catheter. Clean around the opening of the catheter using a new alcohol pad and twist the new cap into place until you feel a slight click as the cap locks. Clean the skin around the catheter site using the last alcohol pad. Place the foam pad around the catheter. Wind the catheter in loops and hold it on top of the foam pad. Then place the gauze pads over the catheter. The self-adhesive dressing has 3 layers: a printed liner, a clear, thin dressing, a center panel, and frame paper backing. Remove your gloves before applying the self-adhesive dressing. Hold the self-adhesive dressing and peel the printed liner from the dressing, exposing the adhesive surface. Center the dressing over the gauze pads and press it down. Do not stretch the dressing during application. Remove and discard the center panel from the backing. Slowly remove the frame while smoothing down the edges using firm pressure to ensure adhesion. Record the volume of fluid drained on the drainage chart or using the PleurX app. Open the roller clamp on the drainage line by rolling the wheel away from the bottle to release any vacuum left in the bottle. Then, close the clamp on the drainage line completely by moving the wheel toward the bottle. To empty the bottle, remove the bottle opener and flexible cap by placing your thumbs under the rounded end of the bottle opener and firmly press up. Remove the bottle opener from the drainage line by squeezing the flexible cap and pulling it through the bottle opener. Use the bottle opener to create a larger opening in the foil seal by firmly pressing the pointed end into the foil seal and rotating the bottle once inserted. Empty the bottle into the toilet or sink. Then place the bottle in a plastic bag, seal it tightly, and discard it in the trash bin. Used PleurX bottles cannot be recycled. Be sure to read the full instructions for use that come with the PleurX Drainage Kits before you drain. The instructions also include answers to frequently asked questions. If it is an option for you, consider asking a family member or caregiver to learn how to assist you with the procedure. It may be easier with an extra set of hands, although it is not necessary. You should now be ready to drain fluid with the PleurX catheter or the PeritX catheter. Remember to refer to the instructions for use while you are draining to make sure you complete the procedure correctly. Please take a few minutes to read this important product use and safety information.